Glad to have you here today. In this lecture, we'll take a deep dive into a powerful classical formula, 益肾通必方, or benefit the kidney and unblock B syndrome. This herbal prescription is designed for chronic musculoskeletal degeneration, especially cases like osteoporosis or delayed healing after fractures. These conditions are often slow to recover, frustrating for patients, and challenging for clinicians. Through this section, we'll explore the formulas, clinical indications, its roots in traditional therapy, its herbal structure, and its modern applications in rehab and long-term musculoskeletal health. Let's begin by understanding what kind of patient this formula is intended for. 益生通必 formula is most commonly used in individuals suffering from osteoporosis, delayed fracture healing, or chronic musculoskeletal weakness. These patients often present with persistent pain in the lower back, hips, or knees, muscle weakness, and reduced mobility, difficulty walking or climbing stairs, slow bone regeneration after trauma, and often a tendency towards refracture, especially in the elderly. In most cases, these are patients who are either recovering from surgery, recovering from long-standing degenerative joint disease, or simply aging-related bone lossing. From a modern medical perspective, these symptoms stems from several interconnected issues. There's usually low bone mineral density, which makes the skeletal fragile, poor osteoblast function, which shows new bone formation, hyperactive osteoclasts, which break down bone faster than it can be rebuilt, and very commonly circulatory stagnation, especially in elderly patients with low physical activity. Additionally, when someone is immobilized after a fracture or surgery, muscle atrophy develops quickly, making recovery even slower. 益生通必方 targets this mechanism by enhancing circulation, stimulate bone remodeling, and tonifying systematic energy to rebuild tissue. From a TCM point of view, all this reflects a deeper deficiency in the liver and the kidney system. In Chinese medicine, the kidney governs bones and marrow. The liver governs tendons and flexibility. When these organs are deficient, bone healing slows, muscles become weak, and the tendons lose strength. Moreover, chronic illness or aging leads to qi and blood deficiency, which weakens the body's ability to repair itself. And once that happens, stagnation of blood and fluid starts to block the meridians, causing pain, stiffness, and loss of function. This is why treatment must go beyond the symptom relief. We need to nourish the root, invigorate circulation, and restore the body's repair capacity. Classical theory strongly supports this approach. In the Su Wen, it said the liver governs the tendons and the kidney governs the bone. Established the root targeting strategy for musculoskeletal issues. Li Shizhen and Zhang Jingyue, two major figures in Chinese medical history, repeatedly emphasized that chronic bone diseases require tonification of essence and blood. Their view was that no matter how advanced the degeneration, replenishing the kidney liver axis is essential. In modern times, many TCM experts follow this principle, especially in osteoporosis and rehab medicine. So, where does Sheng Tong Fang comes from? It evolved from several classics. Its foundation is 左归丸, or the left, which is a deep kidney essence tonic. Two these elements from Sheng Yu Tang were added to supplement qi and blood. Over time, the formula was refined to suit modern rehab needs, with added herbs for strengthening bone and muscles, warming kidney yang, activating blood flow, and even enhancing immune response for post-surgical healing. This makes it a great example of classical knowledge translated into modern clinical use. Let's begin with the first group of herbs that tonifying qi and blood, which are essential for tissue repair and energy recovery. Huangqi and Dangshen enhance immune response and support energy levels. Danggui and Baishao enrich blood and improve circulation. Chuanxiong helps activate blood movement and relieve musculoskeletal pain. These herbs work together to rebuild the foundation of vitality, especially in patients recovering from long-term illness, surgery, or fractures. The next group of herbs focuses on nourishing the liver and the kidney, which is the true root treatment strategy. 蜀地黄、山萸肉 and 枸杞子 replenish kidney and liver essence. 肉苁蓉 and 白鸡八戟天 warm yang and strengthen tendons and bones. 山药 nourishes qi and improves digestion, absorption, which is crucial in elderly patients. 龟板 and 鹿角胶 are rich marrow enhancing substances that support skeletal integrity. This part of the formula helps restore strength, especially for those with deficiency syndrome marked by cold, fatigue, and fragility. To round out the formula, we have circulation enhancers and harmonizing herb. 川牛膝 is particularly valuable for guiding blood downward, promoting circulation in the lower lip, and improve joint function. 炙甘草 is added to harmonize all ingredients and reduce potential toxicity, especially important in a complex formula like this. Together, these herbs balance the warming, nourishing, and invigorating effects for the formula, making it safe and effectively for long-term use in chronic musculoskeletal recovery. Now, let's talk about how we can modify the formula in practice. If patient experience nighttime bone pain, consider adding duzhong and xuduan for enhanced bone support. If bone healing is delayed, herb like 补骨脂 and 骨碎补 can be added to direct stimulate bone repair. For patients with internal heat sign like red tongue, irritability, irritability or dry mouth at 智母 and 黄柏 to clear heat while still preserve essence. This adjustment ensure the formula is personalized, safe, and more effectively for each patient. Classical theory strongly support this approach. In the 素问, it said the liver governs the tendons, the kidney governs the bones. This establishes the root targeting strategy for musculoskeletal issues. Li Shizhen and Zhang Jingyue, two major figures in Chinese medical history, repeatedly emphasized that chronic bone diseases require tonification of blood. Their view was that no matter how advanced the degeneration, replenishing the kidney liver axis was essential. In modern time, many TCM experts follow this principle, especially in osteoporosis and rehab medicine. Recently, clinical trials back up the use of Sheng Tong formula. A multiple center study shows it significantly improved bone mineral density in post-menopausal women with osteoporosis. In fracture recovery patients, it reduced healing time, improved mobility, and led to fewer complications. Patients also reported lower pain scores, improved sleep, and better quality of life compared to standard care alone. This finding confirmed that many TCM doctors are already observe this formula is clinically valuable, especially when integrated with physical therapy and nutritional support. Let's wrap it up with a quick summary. Sheng Tong Fang is a comprehensive herb strategy for treating osteoporosis, post-fracture healing, and chronic musculoskeletal degeneration. It's rooted in classical theory, but highly adaptable to modern practice. The formula strengthens the liver and kidney, promotes blood flow, tonifies qi, and improves bone regeneration. It can be customized to match individual patterns and used alongside rehab for optimal recovery. This is a great example of how TCM can offer both long-term support and short-term symptom relief. Thank you all for your attention. I'm happy to answer any question or discuss how the formula can be applied in your clinical practice. Thank you.